Добрый день, уважаемые коллеги.
Good afternoon, dear colleagues. On behalf of the government of the Russian Federation, the Ministry for Public Health of the Russian Federation, on my own behalf, I am happy to welcome at the meeting of the Ministers for Public Health of the BRICS states, all of you, and I'm also happy to welcome the members of international organizations. As you know, in 2020, the Russian Federation is chairing within BRICS, and we have planned quite a number of different events, including events in the sphere of public health. But the present-day life brings in certain changes into the program, and the situation is such that we cannot meet face-to-face in Moscow, and for that reason our sessions are carried out in the format of the video conferences. And of course, this is all caused by the pandemic, by the constraints and limitations in the communication between the countries. The pandemic, the new coronavirus, has demonstrated that the society is terribly vulnerable when there is no proper pharmaceutic management of the infection. And today, at the epoch of global contacts, the virus is spreading between the continents. For the first time in the history of the public health, the BRICS countries have come across these large-scale and rather difficult situations, although similar scenarios had been discussed in the past, and the forecasts were drafted, the medical assistance and the accessibility of different pharmaceutical products was also discussed. With all of that, the pandemic is an unprecedented threat that tests our national systems of public health and, on the whole, the sustainability of the countries. And it became quite clear what the role of the medical system is as a macroeconomic notion. The problem of COVID-19 is being discussed at the highest level. Thus, during the 74th session of the General Assembly of the United Nations, quite a number of resolutions, very important resolutions, were passed. These include the well-coordinated measures of reaction to the pandemic of COVID-19. And in this context, a very important aspect of the reaction to the new coronavirus is the consolidation of the efforts of the professionals of the global community and the exchange of the best national practices in order to stop the spread of the disease. The epidemic of the new coronavirus is a joint problem for all the BRICS countries. From the moment it emerged, our countries have been in close contact, exchanging information, coordinating joint actions, providing assistance. We all know that BRICS is the optimal platform for the joint search of effective ways to resolve the national and international problems. Today we're here to discuss the major achievements of our countries in connection with the pandemic and to formulate the expectations for the future actions in this field. We hope that our discussion today is global, based on principal approaches, and will be the basis of the next summit of BRICS in St. Petersburg. And now, dear friends, dear colleagues, I would like to give the floor for the welcoming words to the Deputy Minister of the Minister for Foreign Affairs of the Russian Federation, Sergei Rabkov. The floor is yours. Oh, thank you very much. Esteemed Mikhail Albertovich, esteemed colleagues, on behalf of the Ministry for Foreign Affairs, not as as a Sherpa of Russia within the BRICS states, I would like to welcome everyone. I hope you are all feeling well at this 10th anniversary meeting of the Ministers for Public Health of our countries. First of all, I would like to express my gratitude, sincere gratitude, to everyone who, over the past months, from day to day, risking their lives, has been saving the lives of other people. It's a true heroic deed. The heroic deed on behalf of the medical doctors, paramedics, and medical nurses. accept our gratitude. We hope very much that soon, through joint effort, we overcome the crisis. Today, and the meeting today of the ministers of public health of the BRICS states is taking place in a very difficult period of time. The global pandemic, COVID-19, tests the whole humanity. It's a test for the ability of the global community to react in an adequate way to the risks that emerge unexpectedly. A very serious burden nowadays is not only on the systems of public health, but on different international institutes such as WHO. In this sense, the BRICS countries were quite sure have a special role to play. Over the period of time of strategic partnership, our 5 countries have developed a strong immunity to different types of crises, and COVID-19 is not an exception here. Our joint countries are called upon playing a very important role in the overcoming of the pandemic and the consequences of it. The necessary start has been already laid in the UFA declaration in 2015, when the leaders entrusted us with the following: to develop cooperation in the field of public health, paying special attention to the infectious diseases. And in this context, I really should mention the initiative of the Republic of South Africa concerning the foundation of the Center of the Development of Vaccines of the BRICS states. This was approved during the Johannesburg summit in July 2018. But this initiative has not reached the stage of practical implementation. As for the Russian presidency, for us, the topic of the protection of public health has acquired very special significance. I'm sure you all know about our initiative to create an integrated BRICS system for early prevention of the risk of massive infectious diseases and their spread. We hope this initiative is implemented in the practical sense. And moreover, the Ministry for Public Health of the Russian Federation timely suggested to publish the most advanced measures taken by the BRICS countries in order to prevent the spread of COVID-19. We believe that a document like that is going to be most useful from the point of view of its use not only by the 5 BRICS countries, but by the professionals from other countries as well. Along with the pandemic, the Ministry for Public Health has another responsibility, because solutions and initiatives are expected from this ministry, initiatives that will enable us to go back to the normal pre-crisis times. You know quite well what the Russian researchers are doing to create the effective vaccines against the COVID. I'm not going to speak about the achievements of the professionals. I would just like to mention the importance to coordinate the actions between the 5 countries along the main tracks of the COVID interaction. Hence, the name of your session today, the epoch of COVID-19, global solidarity of the BRICS states for the safety and health. The colleagues from the Ministry for Public Health of Russia have done so much to prepare this meeting of ministers. They spread in advance, they disseminated in advance the documents that you are to discuss and to approve. And we hope very much that we can rely on your support on the eve of the 12th summit of BRICS, which will take place on the 17th of November. This is a very good opportunity to report to the leaders of our states about the work done. Your Excellencies, esteemed colleagues, so much depends on the results of your session. The next vector of the interaction of our countries in the field of public health depends on you. On behalf of the Ministry for Foreign Affairs of Russia, I wish you fruitful work. I rely very much on your constructive approach and fruitful discussions. Thank you. Thank you for your attention.
Thanks a lot. Thanks, Sergey. And now I move we should have talks of the ministers one at a time with their addresses. Allow me to be the first as the host representing the chairmanship of BRICS. Esteemed colleagues, dear friends, allow me in my capacity as the country chairing BRICS to talk about the efforts undertaken by the Russian Federation to counter the spread of COVID-19 pandemic. It is the first pandemic in the digital age, and it has re-engineered the approaches of medical healthcare system, and the role of the healthcare became quite important, and only the well-engineered set of activities is capable of preventing the spread of the pandemic. Important role in the environment of the pandemic is played by the Infection and Sanitary Control Service. Russian Federation has preserved the vertical from top to down infection service in the Russian Federation, and it is this system that made it possible to contain the infection. Another factor, another driver is compulsory health insurance system. In the Russian Federation, all the citizens have medical insurance and are covered for their financial costs when they seek medical assistance. However, the pathogen of COVID-19 is spreading real fast, and it causes complication, increasing the burden, both as far as capacity is concerned and financial burden. The healthcare system in the format existing then was not capable to respond, so re-engineering it was the ultimate task. There were 52,000 cots for adults and children. At the moment, there are more than 200,000 cots. That is, the bed capacity has been increased by a factor of 5. And when the medical entities were being re-profiled, we took into consideration the necessity to provide medical assistance to patients with NCDs. When the initial information about COVID-19 appeared, it was necessary to review, analyze it, and adapt it to the conditions of this country. And of course, the BRICS countries provided the input on the spread of the coronavirus. And within a limited period of time, the Ministry of Health here has developed two documents. One was the guidelines on prevention, diagnostics, and treatment of COVID. And now there is a 9th version of the guidelines. And altogether there were two documents. The true black swan was the digital pandemic that has occupied the virtual space. Fake news, bogus stories, and the government of the Russian Federation, to counter the fake news, has developed the information website Stop Coronavirus RF to provide the information and launch the awareness campaign. Special information system, Federal Register COVID-19, was set up to include the information about all the patients of COVID-19 with the protocols of treatment, and it is this system that consolidates all the data. The register was also the source to take regulation measures and to manage the pandemic. And the register now contains the information of vaccination of the patients as well. Medical consultations were held up on 24/7 format, and different centers are involved into providing telemedical help. To train personnel, the development modules, training modules were developed, and all the personnel was subjected to training. All the countries of the world, including BRICS countries, have been facing difficulties to provide medical products and equipment, and there were difficulties with respect to providing PPE, drugs, and of course we had the backup equipment and medical products, but they were not sufficient to cover all the patients. That's why the industrial capacity was enhanced, and as a result of the mobilization, we have introduced more than 100 screening systems. The nucleic acid tests and the tests determining the antibodies, all together. There are more than 100 test systems from different manufacturers in this country. At present, the Russian Federation has conducted more than 400,000 tests. The first antiviral medical product was registered in the Russian Federation, and it is produced by the pharmaceutical companies. The first vaccine registered in the world, it's Sputnik V, is being distributed in the regions, and the manufacturing capacity is enhanced. The manufacturers has developed the technological regulations, and they have started producing it. Second vaccine has been launched, and there are some other vaccines that are ongoing. There are different technologies used to produce vaccines. At the moment, there is non-activated vaccine clinical trials on the way at present to assess the efficiency and safety. The digital resources are being used, and the global format of interaction of the mobile application to control the tolerance of the medical drug has been developed, and we have the data on the vaccine. The pandemic has uncovered a number of the challenges of the national healthcare system, namely the insufficient mobilization readiness in facing the threats. There are indications that with a high degree of probability we might face the other infectious, contagious pathogens. Some of them are known already, that has developed the resistance for antimicrobial products. It's why today, for the first time in the BRICS history, we are discussing the development of the integrated early warning systems of risks of infectious diseases, and it should be the working mechanism of BRICS intended for the interests of the people, prioritizing the interests of the patients. The year was difficult but very fruitful. I would like to note that we have managed to deal with the other BRICS initiatives, namely under the chairmanship of the Russian Federation and with the support of the Secretariat, support of the global WHO-TB program. We have conducted the 7th, 8th, and 9th agreement of the research TB network, and we support the efforts of the WHO. In conclusion, I would like to wish you courage, stamina, and optimism. All these things are necessary for our work to be fruitful for the population of our countries. And now I would like to give the floor to the Ministry of Health Care of Brazil.
Vamos lá? Estamos prontos? Senhores ministros da Saúde e demais autoridades,
Ministers of Health and other authorities,
é com satisfação que participo deste encontro de ministros da Saúde do BRICS. A ocasião é propícia para renovar o compromisso de nossos países com colaborações inovadoras em saúde.
it is with great satisfaction that I participate in this meeting of health ministers of BRICS countries. This is a propitious occasion to renew our country's commitment to innovative collaborations in the health sector.
Gostaria de parabenizar a presidência pró-tempore russa pelo trabalho desenvolvido em plena pandemia da Covid-19. A manutenção dos trabalhos do bloco fortalece o BRICS como ator institucional no cenário internacional.
I would like to congratulate the Russian pro-tempore presidency for carrying out the group's work during the COVID-19 pandemic. Maintaining the regular work of the BRICS countries makes our stand as an institutional actor on the international scenario stronger.
O BRICS é diferente de qualquer outro bloco do mundo. Nossos vínculos vão além de fronteiras, continentes, idiomas e culturas.
The BRICS is different from any other group in the world. Our bonds go beyond borders, continents, languages, and cultures.
Somos unidos pelo entendimento comum sobre o peso de nossas economias e sobre o papel fundamental de nossos países para o desenvolvimento de todos.
We are united by a common understanding of the weight of our economies and the fundamental role of our countries in global development.
Como ministros, enfrentamos desafios comuns na promoção da saúde em nossos países, ainda mais no contexto da Covid-19. Por isso, quero parabenizar a presidência pró-tempore russa pela iniciativa de publicar a compilação das medidas sanitárias tomadas pelos países do BRICS para conter a disseminação da Covid-19.
As ministers, we face common challenges to promote health in our countries, especially in the context of COVID-19. For this reason, I wish to congratulate once again the Russian PPT for compiling all healthcare-related measures taken by BRICS countries to counter the spread of COVID-19.
Assim como outros países BRICS, o Brasil é um país continental que apresenta diferenças regionais importantes, seja em densidade populacional, seja em urbanização, seja em estruturas de saúde ou aspectos sociais e econômicos. Portanto, no Brasil, a resposta à Covid-19 exigiu medidas proporcionais e adaptadas à realidade local e regional.
Like other BRICS countries, Brazil has continental dimensions and relevant regional differences in population density, urbanization, health structures, social and economic aspects. Therefore, the Brazilian response to COVID-19 required measures that were adapted to local realities.
sistema de saúde brasileiro foi ferramenta indispensável para combater uma emergência pública de saúde. Da atenção primária à atenção especializada, da pesquisa e desenvolvimento em medicina à vigilância em saúde, passando por capacidade laboratorial própria para a produção de medicamentos e vacinas. A luta contra a Covid-19 não seria possível no Brasil sem a capacidade e a capilaridade do Sistema Único de Saúde, o SUS. Nossa ênfase atual em saúde mental, cujo quadro no Brasil se agravou por conta da pandemia, também passa pelos serviços do SUS.
In this context, the Brazilian national health system has been an indispensable tool to counter public health emergencies, from primary healthcare to specialized healthcare, from medicine research and development to health surveillance, passing through laboratorial capacity to produce medicines and vaccines. The fight against COVID-19 in Brazil would not be possible without the capacity and the capillarity of Brazil's unified health system, the so-called SUS. SUS services have also been central to our current emphasis on mental health, because the disease in Brazil has worsened due to pandemic quarantines.
O Brasil tem grande interesse em intensificar a cooperação em saúde no âmbito do BRICS, trocando experiências, fazendo pesquisas conjuntas e desenvolvendo novas tecnologias. Também queremos aprimorar o diálogo sobre as questões da agenda internacional de saúde, tanto na Organização Mundial da Saúde, como em outros fóruns internacionais relevantes. Nesse contexto, quero ressaltar a importância do engajamento dos países do BRICS no processo de reforma da OMS.
Brazil is greatly interested in intensifying health cooperation within the BRICS through exchanging experiences, fomenting joint researches and technology development. We also hope to improve the existing dialogue on multilateral issues within the World Health Organization and other relevant international fora. In this context, I wish to emphasize the importance of BRICS engagement in the WHO reform process.
No que tange à vacinação, o Brasil considera que a imunização para a Covid-19 deve ser considerada bem público global. Recorda a importância das discussões sobre o acesso equitativo de nossas populações a medicamentos, vacinas, diagnósticos e a outros insumos médicos que sejam eficazes, seguros e de qualidade.
With regards to vaccination, Brazil considers that immunization against COVID-19 should be considered a global public good. I recall the importance of discussions on equitable access to affordable, quality, effective, and safe medicines, vaccines, diagnostics, and other medical products that meet the health needs of our population.
Juntos, representamos o maior parque industrial de produção de insumos para a saúde do mundo. O Brasil se orgulha de sua robusta capacidade produtiva na área de imunobiológicos, com alta capacidade produtiva interna. Nossos laboratórios públicos estabeleceram parcerias vantajosas com grandes empresas internacionais para testes clínicos e produção da vacina no Brasil. Além disso, já contratamos 42 milhões de doses da vacina por meio da COVAX Facility.
Together, we represent the world's largest industrial park for health supplies. Brazil is proud of its robust national production of immunobiologicals. Our public laboratories have established advantageous partnerships with international companies for testing and production of vaccines in Brazil. Furthermore, we contracted 42 million doses of vaccine through the COVAX facility.
No que diz respeito ao impacto do BRICS na continuidade dos serviços de saúde, não posso deixar de mencionar nossa agenda comum no combate à tuberculose. A rede de pesquisas do BRICS, em TB, criada em 2017, é um bom exemplo de cooperação prática e técnica. No Brasil, desde 2010, observamos redução na incidência e na mortalidade por TB. No entanto, a pandemia de Covid-19 pode comprometer o progresso alcançado ao longo de mais de uma década no controle da TB.
With regards to the impact of BRICS countries on the continuity of health services, I must mention our common agenda in the fight against tuberculosis. The BRICS TB Research Network, created in 2017, is a good example of practical and technical cooperation. In Brazil, since 2010, we observed a reduction in TB incidence and mortality. However, The COVID-19 pandemic may jeopardize the progress made over more than a decade in TB control.
Por essa razão, entendemos que é necessário responder de forma célere, articulada e multissetorial aos desafios impostos pelas duas doenças, fortalecendo as estratégias nacionais de TB com financiamento robusto e com cooperação técnica para alcançar o objetivo global no fim da TB.
For this reason, we understand that it is necessary to respond in a quick, articulated, and multi-sectorial manner to the challenges imposed by both TB and COVID-19, strengthening national TB strategies with robust funding and technical cooperation to achieve the global goal of ending TB.
Esperamos que, ao unir capacidades produtivas ao compromisso político, possamos fortalecer nosso sistema de saúde e resposta a pandemias, alcançando a cobertura universal de saúde e atendendo às necessidades de saúde de nossas populações.
Brazil hopes that by uniting BRICS productive capacities and political commitment, we can strengthen our health systems in response to the pandemic, achieve universal health coverage, and meet the health needs of our populations.
Por fim, gostaria de lembrar que a saúde é promotora de desenvolvimento humano, econômico, geradora de riqueza e também de equidade, e fundamental para a criação de sociedades estáveis e com oportunidades iguais para todos. É com essa perspectiva que devemos promover o debate sobre a pandemia do coronavírus. Muito obrigado.
Finally, it is important to keep in mind that health promotes human and economic development, generates wealth and equality, and it is fundamental to the creation of stable societies with equal opportunities for all. This perspective is the one that we must engage on when we debate about the pandemic. Thank you very much.
Спасибо, господин министр. И сейчас я хочу...
Mr. Minister, and now I would like to give floor to the Minister of Health and Family Welfare of the Republic of India. The floor is yours.
Excellency Mr. Mikhail Murashko, Minister of Health of the Russian Federation, Excellency Mr. Eduardo Pazuello, Minister of Health of Brazil, Excellency Dr. Ma Xia Ovei, Minister of National Health Commission of China, Excellency Dr. Jewelini Lawrence Makhije, Minister of Health of the South Africa, other esteemed dignitaries, ladies and gentlemen. Today we meet virtually after having experienced the greatest health-related challenge faced by the modern world and having portrayed great resilience against this COVID-19 pandemic. Before I proceed, I would like to express my sincere gratitude to all the frontline workers, healthcare workforce, researchers, policy makers, and many others who made this journey possible with risk to their own lives. I believe we continue to become stronger as we gain greater awareness about emergency preparedness strategies in light of a global health crisis. I feel honored to be a part of this integral discourse about increasing global solidarity for ensuring health safety of all our citizens. BRICS represent some of the world's fastest growing economies and account for nearly 40% of the world's population, and thus have always had a great role to play in influencing the state of global health. These 5 nations, Brazil, the Russian Federation, India, China, and South Africa, have been working towards overcoming several common health challenges, concerns about communicable and non-communicable diseases, inequitable access to health services, rising healthcare costs, and now the COVID-19 pandemic. I believe that over the past few years, the BRICS nations have embarked upon a journey marked with substantial reforms that have helped us provide improved healthcare services, financial protection, and universal health coverage. Excellencies, this pandemic has demonstrated the vulnerability of humankind to exigencies, making us realize the vital need to further strengthen our healthcare systems. At the onset of pandemic and its spread in India, a rapid and robust institutional response was activated under the leadership of our visionary Prime Minister, Shri Narendra Modi ji. While the central government steered this movement with constant monitoring and evaluation, providing hand-holding support to the states to tackle this crisis holistically, our respective state governments also undertook various unique strategies to keep their response mechanism agile and vigilant. Our decentralized but unified mechanism to provide universal, accessible, equitable and affordable health care to one and all was the driving force behind our unique response strategy for COVID-19. India's COVID-19 response approach was preemptive, proactive and graded, starting with early screening and isolation of passengers, imposing lockdowns and creating containment zones to prevent overburdening of health facilities and personnel, propagating behavior change as an integral move to contain the spread, and ultimately recognizing the imperative need for reopening of the economy in a phased, cautious and responsible manner. India has curated its response keeping in mind the large population size. Several technological innovations were also leveraged in our pandemic management efforts. While applications such as Arogya Setu and Itihas facilitating rapid contact tracing and surveillance, the interactive and dynamic COVID India portal enabled real-time tracking and monitoring. The iGOT portal, integrated government online training, was also launched as a training module for our frontline health workers. We worked round the clock to boost domestic production and expand our healthcare workforce, thus bridging major gaps in demand and supply of essentials such as testing kits, PPEs, ventilators, etc. Furthermore, an Atmanirbhar Bharat movement has now been launched to become self-sufficient in all our capabilities and capacities. Excellencies, our collective nations have had a rich history of successfully tackling various disease outbreaks in the past decades with an all-inclusive and equitable approach. And as emphasized in the BRICS UFA Declaration 2015, we have to proactively work towards enhancing our strategic partnership and systems of knowledge exchange, building successful collaborations on the basis of principles such as openness, solidarity, equality, and mutually beneficial cooperation. Excellencies, we need an aggressive roadmap and a strong show of solidarity to curtail any present and future risks threatening safety and well-being of millions of global citizens. There is also an impending need to share reliable and accurate data and any lessons drawn in the course of managing this pandemic to eliminate any threat of emerging disease outbreaks and ensuring equitable and inclusive access to healthcare for one and all. We have come quite far in the past few months, and I am confident that our respective nations will come out strong and resilient in the management of COVID-19 and any such outbreaks in the future. Looking forward to many fruitful collaborations with you all. Thank you.
Спасибо большое, господин министр.
Very much, Your Excellency. The initiative of the roadmap should be considered, of course, but today there will be another initiative to be discussed, and so India will definitely come up with its point. Allow me to give the floor now to the Deputy Chair of the State Commission for Public Health of the Chinese People's Republic, Madam Li.
Your Excellency, Minister Mikhail Murashko, Honorable Ministers, Excellencies, colleagues, ladies and gentlemen, I take great pleasure in joining you at the 10th meeting of BRICS Minister of Health. Of the National Health Commission of China, I would like to pay tribute to all of you and thank the Ministry of Health of the Russian Federation for their thoughtful arrangements. COVID-19 is the worst infectious disease pandemic in the world in a century. China is committed to making people's lives and health its first priority, and with firm courage and indomitable resolve, China has scored major strategic achievements in the nationwide fight against COVID-19. At present, the situation of COVID-19 in China has stabilized and the good momentum is being consolidated, with social and economic order being restored at a faster pace. However, the international situation remains grave and complex. The WHO warned that SARS-CoV-2 would not disappear, and as the Northern Hemisphere enters the seasons of autumn and winter, when respiratory infections have a high incidence, the number of COVID-19 cases, ICU admissions, and hospital admissions is already showing a worrying upward trend. China will continue adhering to the strategy of joint, community-based prevention and control, combining both the strengths of communities and the strengths of professionals. Efforts have been intensified to strengthen interagency policy coordination and information sharing. Extensive social outreach and health education has been conducted. Surveillance and early warning has been enhanced. Nucleic acid tests, or NATs, have been carried out for key populations and key premises. Strict efforts have been made to prevent cluster outbreaks. Measures have been improved for NATs, quarantine, and medical observation of inbound passengers. Inspection and quarantine of imported cold chain food has been intensified. Health monitoring and protection of people employed in the relevant sectors have been improved. Measures have been strengthened for joint prevention of both flu and other diseases. Meanwhile, good preparedness is in place. Once there is an outbreak, emergency response will be initiated promptly to stem it at the very beginning. In order to jointly respond to COVID-19 and safeguard global health security, I would like to make the following proposals. First, we should firmly support multilateralism and the leading and coordinating role of the WHO in the global response to public health emergencies. BRICS countries should step up political and financial support. For the WHO, actively support the Access to COVID-19 Tools Accelerator, or ACTA, earnestly implement the resolution of the 73rd World Health Assembly, and effectively safeguard global health security. Second, we should actively carry out international cooperation for joint prevention and control. BRICS countries should continue strengthening experience sharing on prevention, control, and treatment, keep communication on experience and practices in business recovery, and actively carry out cooperation in development of drugs and vaccines and in epidemic prevention to prevent cross-border spread. We should firmly reject the politicization of the pandemic. We should be science-based, stay united by mobilizing all parties to adopt preventive measures so as to minimize infection risks. Third, we should build robust health systems and join hands to help developing countries to improve their response capacity. BRICS countries should increase public health inputs and ramp up early warning system to strengthen prevention, control, and treatment capacities, thus safeguarding people's health. Within the WHO framework and the multilateral governance mechanisms, BRICS countries should advance communication and coordination, and capacity building of health systems in developing countries should be improved through South-South cooperation. We should make health services more equitable and accessible. China welcomes the establishment of the BRICS Integrated Early Warning System for preventing mass infectious diseases risks. It is recommended that a cooperation network of experts and technical institutions should be formed to focus on priority areas of cooperation. China applauds the consolidated document, BRICS countries' measures taken in the field of healthcare to counter the spread of COVID-19, compiled under the auspices of the Ministry of Health of the Russian Federation. We stand ready to share our experiences and practices in battling the pandemic with the international community, BRICS countries included. Ministers, colleagues, the global battle against SARS-CoV-2 is still at a crucial juncture. China will continue updating our online knowledge center for COVID-19 response in order to share experiences and protocols in prevention, control, and treatment with all parties, and to provide support to countries in need to the extent possible. I look forward to close solidarity among BRICS countries in responding to the pandemic. We will work along with the international community to build a global community of health for all and to make unremitting efforts towards the realization of the 2030 health-related sustainable development goals. Thank you all.
Спасибо большое, господин Дени. Обмен протоколами лечения – это очень важный элемент координации сил медицинской службы, и система предупреждения, о которой вы упомянули, на наш взгляд, это одна из ключевых систем, которая должна срабатывать вовремя. И сейчас я хочу предоставить слово заместителю министра здравоохранения Южноафриканской Республики господин Матунда.
Republic of South Africa, Mr. Matunda.
Thank you very much. Let me greet our host, the Minister of Health of the Russian Federation, Dr. Mikhail Murashko, the Minister of Health and Family Welfare of India, the National Health Commission of China, and also the Minister of Health of Brazil. The South African government congratulates you, the Minister of Health of Russia, on hosting of this 10th meeting of the BRICS Ministers of Health, especially during these trying times that we face due to COVID-19 pandemic. As we approach the end of 2020, it is clear that we are still in the grips of the novel coronavirus, with little more to protect ourselves than the social distancing strategies, which have had devastating effects on the social and economic lives of our people. As a brief overview from South African side, our response to COVID-19 began with intensified point of entry surveillance, surveillance at our ports of entry, screening and testing leading up to identification of our first case of COVID-19 on the 5th of March 2020. This was followed by an aggressive community screening and testing campaign, which crystallized in the nature of our community transmission after the first cases, imported cases, by illuminating high level and also some low level of transmission in various areas in the country. This allowed us to detect, to direct our resources accordingly as we moved to ramp up our capacity for testing, case management, contact tracing, quarantine, and also isolation. Through the capacity building program, we're able to add 20,000 more health facility beds and also 40,000 quarantine beds and isolation facilities. But also we are able to build additional field hospitals and also partnering with private service providers. Having passed our peak, which was in July this year, we are now implementing a strategy, a search strategy to ensure that we are prepared for a nuanced approach to deal with the subsequent second surge, while at the same time continuing to deliver our routine health services for non-communicable diseases and also for other communicable diseases such as TB, such as HIV, malaria, and others. It is encouraging to report that overall the number of new positive cases in South Africa have declined substantially since the peak in July. However, we are noting with concern some cluster outbreaks which threaten to drive a resurgence in the country, particularly as we approach our summer holiday season, which is characterized by high frequency of inter-regional and inter-provincial movement. We are now encouraging all our provinces and regions and municipalities to pay attention to these increasing numbers and quickly mount a response to stop and clamp down on the cluster outbreaks, including contact tracing, quarantine, and isolation. In South Africa, we are determined not to return to a hard lockdown, which we went through during April up to June. Recently, our President Ramaphosa, announced a reconstruction and recovery plan that will set us on a path of economic recovery as we rebuild our lives after the peak of the COVID-19 surge. The success of the economic recovery plan will depend on our ability to remain vigilant on issues of prevention going onwards to prevent the further spread of coronavirus, containment strategies, mitigation measures, and also epidemic control. Excellencies, no doubt we are all anxious to have at our disposal more potent instruments against COVID-19, such as effective therapeutics and vaccines, so that we can successfully hold the devastation of this virus. Nevertheless, we do have some tools to work with to provide supportive clinical management. It is therefore critical as a group of BRICS nations that we support and advance initiatives that ensure universal access to highly effective and proven life-saving COVID-19 tools, such as personal protective equipment, oxygen, rapid diagnostic tests, and also therapeutics such as dexamethasone. In the light of some of the recent development, we hope that multilateralism will now be the order of the day, and that BRICS partnership will add its weight to advocate for some of the more difficult decisions that need to be made, such as temporary patent waivers and cross-border management to facilitate the movement of COVID-19 and other major health and economic commodities. Therefore, Excellencies, let me just comment briefly on the declaration which we will be adopting later this morning or this afternoon. As South Africa, we support the efforts of BRICS to strengthen dialogue and cooperation in the fields of social protection, decent work, gender equality, youth and public health to address challenges including inequitable access to health services and medicines for communicable and non-communicable diseases and the growing health cost. We acknowledge the need to overcome barriers to access to health, access to affordable, efficient and efficacious, safe and quality medical products, vaccines and other health technologies. In this regard, we support BRICS concept of an integrated early warning system to prevent mass infectious risks. We also support we welcome the intention to establish cooperation in the field of regulation of medical products use, and pharmaceuticals and other ingredients. I know we're still going to talk about this. We also support other coordinating mechanisms which we're going to be talking about. As I've mentioned, we support the creation of early warning system. We acknowledge the gaps that still exist in global pandemic response and preparedness and response. We therefore call upon WHO, the BRICS, and all partners to provide the leadership and support to ensure that the world is better prepared to cap the impact of future health-related crises. We have faith that with the ongoing support of all experts in our countries, including WHO, we do have a WHO search team deployed in our country, and partners in multiple sectors, we will soon bring COVID-19 under control. We also wish to assure you that South Africa remains committed to support BRICS efforts to enhance the resilience of health systems towards global economic recovery. I thank you, Honorable Chairperson. Thank you.
Спасибо большое.
Well, thank you very much, particularly for your words of support. I do believe that the initiative mentioned by you concerning the memorandum on medical products should be promoted, and it's one of the forwards of sustainability. Medical products should be available in the market. And now allow me to give the floor to the Director of WHO Regional Office, Mr. Hans Kluger. You're welcome.
Thank you very much, Minister Dr. Murasko, and all ministers of the BRICS countries, excellencies, for providing WHO with the unique opportunity to present at this very important forum, also on behalf of WHO Director General Dr. Tedros. At the moment when we all continue to grapple with the impact of COVID-19 on our collective communities. Over the last few months, Minister Murasko, you have shown us what solidarity looks like in action. Russia's contribution to global efforts against COVID-19 and Russia's BRICS chairmanship, which strengthened the role of the United Nations in global affairs, has been vital. And thank you to all the BRICS countries for your strong support to the mandate of WHO and UN. This meeting comes at an important juncture in the COVID-19 crisis. Over the last few months, I have followed all your national responses and have been impressed by the resilience, tenacity, and capacity to innovate in your countries, which has undoubtedly saved many, many lives. I am deeply encouraged by your ongoing commitment to multilateralism. However, there is much work left to do. As Europe, alongside with the United States, again finds itself at the epicenter of the pandemic, our health systems and communities are being put to the test. As the challenges grow, platforms like the BRICS Alliance will help see us through this global crisis, ensure stronger health security, and put us back on track towards achieving the Sustainable Development Goals. In dealing with the resurgence, we take 3 lessons that the pandemic has taught us so far. First, health security relies on strong health systems and equity. Second, the economy and health are inextricably linked. And third, solidarity and courage will see us through this battle. The first one, COVID-19 has revealed that strong health systems are central to the health security of our nations. To respond to the current crisis, our health systems need to operate along a dual track, maintaining essential services, and readying them to deliver a novel vaccine. Universal and equal access to services is essential to recovery, not at least for non-communicable diseases, and also very important, as many of you mentioned, tuberculosis prevention and control. As the pandemic continues to disproportionately affect the most vulnerable, we must ensure affordable access to services and to vaccines, diagnostic and therapeutics. This is not just a moral and a public health obligation. It is an economic imperative. Second, the link between health and economic development continue to be pushed to the fore. Investing in health systems makes economic sense. For the recovery and protection of our communities, health needs to be elevated on the political agenda. To support this, I have convened a pan-European Commission on Health and Sustainable Development to rethink policy priorities in the light of pandemics, chaired by Professor Mario Monti. Third, we need unity, solidarity, and courageous collective action. As we reckon with the challenges ahead, it is clear that to meet the needs of our citizens, we must work across sectors and in partnership. From WHO, I reaffirm our commitment to you to further strengthen our scientific cooperation to BRICS research networks. This will continue to be a cornerstone of our efforts for unity. None of us are safe until all of us are safe. BRICS countries are home to 40% of the world's population. Together, we are stronger, but the health of one country's population is essential for the COVID-19 recovery of every country's population. Despite the challenges, I urge leadership to convey hope and determination. WHO is ready to assist as your 5 very important countries mobilize intellectual, economic, and productive capacities in the interest of health security and prosperity for all. I am optimistic that with sustained collective efforts and a focus on the most vulnerable, we will achieve exactly that. Thank you so much, and thank you again, Dr. Morasco, for your leadership.
Спасибо большое, господин Клюге.
Thanks a lot, Mr. Kluger. Now, I would like to give floor to the director of the Global TB program, Mr. Teresa Kassa.
Excellencies, ministers, distinguished guests, Regional Director Dr. Hans Kluge, dear colleagues. I am pleased to join this historic and important meeting of BRICS Ministers of Health, chaired by the Russian Federation. The whole world is faced today and fighting with a new threat called COVID. But so-called old threats and old diseases as TB are still continuing affecting millions of lives worldwide. TB remains for many years the biggest infectious disease killer in the world, claiming 1.4 million lives annually. BRICS countries bear almost 50% of the world's TB burden. As you are aware, 2 years ago, the nations of the world gathered for the first United Nations high-level meeting on tuberculosis. Heads of states and other leaders made bold commitments to accelerate the response to end the world's top infectious killer. These commitments have offered hope for ending the death and suffering of millions worldwide who are struggling with TB, a preventable and treatable disease. Just last month, in follow-up to a request made in the UN Political Declaration on TB, the UN Secretary General released a progress report on ending TB. The report highlighted that while high-level commitments have galvanized global, regional, and national progress towards ending TB, especially in BRICS countries, urgent and more ambitious investments and actions are required to put the world on track to reach targets. Progress and actions in the BRICS countries are translating to global wins for NTB efforts. Sadly, the COVID-19 pandemic threatens to reverse the gains we have made in the fight to MTB. The impact of the pandemic on TB services has been severe. Data collated by WHO from over 200 countries, including BRICS countries, show sharp drops in TB notifications. Our modeling suggests that a 50% drop in TB case detection over 3 months could result in nearly 400,000 additional TB deaths in 2020 alone. In the same time, TB programs and health workers, TB lab networks were heavily involved in the COVID response, and it clearly shows that investments in TB are investments into the strengthening health systems and their preparedness. COVID-19 has exposed several important gaps in TB prevention and care, which needs to be addressed through research urgently. Just one fact, we are still using not very effective vaccines, which is over 100 years old. This is why the world and the work of the BRICS TB Research Network is so vitally important. Since its establishment at the WHO Global Ministerial Conference on Ending TB, hosted by Russian Federation in 2017, BRICS TB Research Network has conducted several collaborative research projects with the aim of addressing unmet needs in TB prevention, diagnosis, treatment, and care. The network is also co-financing joint research projects, pioneering a bold approach to address funding gaps in research. Members of the network formally meet at least 3 times a year to assess, interpret, and disseminate their findings. WHO Global TB Program provides, as it was requested by BRICS countries, support to the network secretariat. At its last 3 meetings, the BRICS TB Research Network being chaired by the Russian Federation, and deliberated on key actions to advance innovations to MTB during times of COVID-19. We welcome the proactive leadership and commitments of BRICS countries through your honorable ministers and delegates, and through the BRICS TB Research Network to strengthen collaboration to fight both TB and COVID-19. Thank you all for your commitment. The health of millions of people and their families rests in your hands, and it's a huge responsibility. We all cannot let them down. By working together and showing joint leadership across efforts to against COVID-19 and TB, we can ensure adequate care for those most in need and for those most vulnerable. Together, we can ensure no one is left behind. We can and we should make a difference. It's time for action. Thank you.
Спасибо большое.
Very much. Thank you, Teresa. I would like to say that over the period of our fight against COVID-19, the number of studies with X-ray technology has increased, and there is a system of artificial intelligence that is extensively used. It makes it possible to evaluate, to assess properly the images we get with the help of computer tomography technology. And along with that, we are able to reach the new level of diagnostics in such diseases as TB, as malignant tumors are part of that field, and we, as a result, we have a lot of experience for further development in these fields. And so it seems to me that these achievements should be considered in the context of our struggle against COVID-19 and prevention and early prevention and treatment of TB. So allow me to speak about the integrated system of early prevention of the risks of infectious diseases. Well, of course, COVID-19 is a challenge for the infectious security of the nations, of the BRICS nations. The effective counteraction in the present-day world is impossible without the coordination of effort. Our readiness and willingness to work together in this field is reflected in the UFA declaration of the BRICS states. The BRICS states make their important collective contribution into the provision of global security and safety, into the protection of health, considering, of course, the public policy in health. And thus we initiated the integrated system of the early warning and early prevention of infectious diseases. This system of early prevention of risks should be a mechanism for the coordination of joint efforts aimed at the prevention and early actions against the infectious diseases and their impact on the population of the countries of BRICS. For the funding of the joint programs and projects for joint work within the system of early prevention, we are thinking of establishing a new bank of the BRICS states. We assume that the work will be done in the four main fields. First, the analysis and monitoring of the current situation, then preventive and anti-epidemic measures, strengthening of the research potential of the BRICS countries, and fourth, the strengthening of human resource potential, improving of the training of professionals. Then the experts and the coordinators appointed at the countries will discuss the format of the functioning of the system of early warning system and the proposals of the countries will be accumulated considering the national priorities. Dear colleagues, we received the approval of the integrated early warning system from Brazil, China, and South Africa. We would like to thank countries for that, preserving the high level of trust between the countries, between the partners. We ask the Republic of India to support the idea of the integrated early warning system, particularly since today the roadmap was mentioned, the roadmap which needs to be created within the framework, and its implementation could be also very important. We would like to see the goodwill on behalf of India. If India requires some time, then we're willing to wait for their response till the end of the week. And we hope that by the end of the week, this idea is approved and then presented to the leaders of our states at the summit. And then another field of our work, that is the survey of the joint measures. I would like to present this system. This is the joint work. BRICS countries measures taken in the field of healthcare. This brochure was prepared in English so that all the countries, all the BRICS countries could make use of it. So it's a survey of all the advanced measures, and this will enable all the BRICS countries and other countries in the world to make use of our information platform for the implementation in their own countries. Now, this survey was planned in order to make sure that we are familiar with the timely measures. And finally, thanks to your participation, we have the vast material accumulating the advanced practices and the extensive experience accumulated by all the countries. I'm quite sure that this particular document will be extensively used by the BRICS states in order to make use of the experience of the other countries and their implementation in their own countries. So this survey can be presented at other international platforms, at the United Nations, with WHO and different other organizations, as an example of joint effort taken by the BRICS states. And I would like to ask the director, the regional director, Mr. Kluge, who today is present at our session, to inform the Director General of WHO, Dr. Tedros Adhanom, about the document and the potential of its use within the framework of WHO. And I would like to touch upon the memorandum of understanding between the regulatory bodies of the BRICS states. Now, this idea was born about a year ago, more than a year ago, and at that time it was quite topical, and today, as we see it, its significance is even greater. Because the medical projects and the efforts aimed at the prevention of deficit of medical projects, the improvement of the system of trust and confidence between the countries, that's what we should all work for. In spite of all our differences, BRICS countries come across similar problems in the field of public health. And we began to work on the memorandum, and today we are at the final stage. We would like to mention the contribution of all the regulators of the states into the preparation of the document in order to provide conditions for further consolidated work in the field of regulation of medical projects. The ANVISA, the Brazil is very important, the Federal Service, the Russian Federation played a significant role, the Central Organization for the Control of Standards for Drugs, CDC of India is very important. The National Administration for Medical Products of the Republic of China, the South African Administration for Regulation of the Republic of South Africa. Then this memorandum complies with the principles of multilateral work and focuses on the exchange of practices and the safety and security of the use of different medical preparations of drugs. And also we are inviting everyone to take part in the meetings organized by the regulatory bodies. This will enable the citizens of our respective countries to have access to safe drugs. A year ago, when we discussed this issue, our experts in Brasilia supported the memorandum, and thus they expressed their willingness to sign the document. Unfortunately, the sanitary and epidemiological conditions of this year prevent our face-to-face meetings and signing of the memorandum. So we suggest that we support the adoption of the memorandum between the regulatory bodies in the near future. And allow me to express our joint hope that the further implementation of the Memorandum of Understanding will foster cooperation in the field of health between the BRICS states. I would also like to mention that this particular tendency is retained among the international regulators, ICMRA and ARF, the regulators for drugs and medical products. And we do believe that our joint efforts will foster the rapprochement of our countries and our joint efforts. And finally, I would like to draw in some conclusions. I would like to say the following. Today, colleagues, we've had one of the most fruitful meetings, and I would like to thank every single participant for the opinions expressed and for the preparation of the document. Unfortunately, indeed, the epidemiological situation is such over this past week that we can see it actually worsening. So the BRICS countries have already done quite a lot against COVID-19 spread, but still a lot needs to be done, and we really have to work at a larger scale. COVID-19 also revealed and manifested certain problems, problems associated with the planned provision of medical support for the wide circles of the population. That means we have to work on the improvement of the systems of public health in the countries. This is something we need to work on. The systems of public health in the BRICS countries should exist for every single citizen. As I said earlier, it is impossible to get ready to something that has never happened before, but we should draw lessons. We should learn how to act proactively. We all will have to create a flexible system of warning and reaction to the whole range of threats. This is an ambitious goal, and we wish success to all of us with that. Thank you for your attention. Thank you, dear colleagues.